Hello, everyone. If you are here, I know that you are looking for tips and tricks how to revise and get ready for your exams, which is absolutely great and nothing wrong with that. It's amazing. Okay, let's dive in straight away to the juicy part. If you're going to your Google search or whichever search engine you're using, right inside National Examination Board for Dental Nurses written exam examples. And then you will come up with official website right here with resources. Once you click to the resources, sorry, my computer is slow, I know. It comes with this page up. Just keep scrolling down. It comes with these lot of resources right here. Here is lot of questions before, after, during, certificates, and those other questions. But what we are actually focusing on is syllabus and sample written paper questions. Okay, when we are clicking on the written paper example questions, it comes up with these certain pages. Right here, if you scroll down, question one. All these questions, not all of them, some of them was coming up even in my exam back then. Sadly, I can't tell you which one of those because of duty of condor, but they were there. And as I scroll now, I do recognize them. So, my advice to you, if you're going through these questions without looking for answers in a lesson book and you can confidently answer those, that's great. That's amazing. If you do struggle though, I have a great advice for you. Okay, we are going back to resources, right? And here we have syllabus. Once you click here, a big file of 59 pages is open here for you, okay? Don't get scared of that number though. On top here, once you open this file, sorry, just let it load a little bit, you can see the modules and what's covered in each module. If you're going through those modules and you do understand, okay, I feel confident in this module, great, move to next module, test your knowledge. And if you feel that you struggle answer these modules, you're in a great place because I will use such a juicy tip now. Okay, once you scroll more down, all those modules are broken down into sub modules, if I could say that. So, for example, this is module one, and then there is all these sub um, modules. I hope I can say that. Um, where you can test deeper your knowledge and understanding about that module. But let's go to the juicy part, okay? So here, right here is assessment method, which means this is the way how they will assess your knowledge. You can see either it will be through the written exams or medical questions or OSCE. This is the most juiciest bit. Everything to be prepared for your exam is right there in their original website. Okay, just to show you and explain. Let's go more down. Okay, still module one. Students should be able to demonstrate competency of, for example, maintenance of professional appearance and behavior, including being punctual and polite when attending courses, examinations, and in the workplace. So it will be assessed through record of experience and OSCE, meaning that, okay, this will be covered in your OSCE. So you know that you need to introduce yourself, say my name is um I don't know, Liana, I'm a student nurse of the day. My uniform is clean and tidy. My hairs are tied in a bun. I have small earrings, no eyelashes, no nail varnish. My elbows, hands are bare below elbows, and all those etc. That will be included in your OSCE. Boom! I hope now you understand where we're going in this juicy information. Okay, let's keep scrolling just to give you even better explanation. Um, let's stop at other module. Okay, so just to cover something else. Okay, module two: student to be able to demonstrate competency of. Okay. Compliant with national and local clinical governance and health and safety requirements, acting within the dental regulatory standards and other legislations related to your role. How it will be assessed? Through records of experience, and OSCE. Here you have all what you need to understand how you will be assessed. Um, so here you can say appropriate storage, handling, and use of materials. All these subtitles right here. This is how you will be assessed. Okay, let's dive in. Um, let's open maybe module 3 then. Let's keep going now. Okay, students should be able to demonstrate competence of monitoring the patients, to identify complications, and take the necessary actions, recording an accurate patient history that should include personal details, social, dental, and medical conditions, how on dental treatments. Okay, how it will be assessed, records of experience, and OSCE. It could be as simply of your dental nursing charts, right? This is how you are typing information related to their dental records in their mouth, or their teeth. Um, let's keep diving. Okay, module 3. Here we have medical emergencies. How to be assessed through medical emergency questions, extended medical emergency questions, and OSCE, which means that this module related could come up in your question in OSCE. For example, it can say that your patient comes really anxious inside. You see in medical history they have like panic disorder, what you need to pay attention to, and this kind of question. It doesn't mean that you would get like proper situation coming up in your Zoom OSCE. It could be something simple like that. Just say that you have anxious patient and you have to kind of think straight away. Okay, anxious patient. That means I need to be more gentle with them. Maybe I need to book a longer appointment for them. Um, I need to reassure them. Maybe if it is without local anesthetic procedure, you can explain to your patient that there is nothing to worry about. No local anesthetic will be involved in the procedure, and kind of reassure them. I hope you see where I'm going with this. Um, okay, module 3. Let's keep going. Safe patient care, current best practice guidelines. Okay, so record experience and OSCE. So this will be your GDC standards. GDC standards 1 to 9. You have to know them by heart, and they'll be assessed in your OSCE. And my experience says that every year so far, they have one GDC question. So I definitely can say that so far their chart here is very accurate. So my darlings, if you're going through this modules and sub-modules which are there and you feel you have a gaps there, this is how you can test yourself and see if you have any gaps in your knowledge, and plus you know exactly how it will be assessed, so you know the signs to look out for. I hope many of you knew this before, but for those who you didn't know, I'm so happy you landed on my page, and I hope you will get your hands on this as soon as possible, and I wish you best of the luck to pass your exams. Very soon I will make also my another video. National Examination Board for Dental Nurses also have a official examples for Zoom OSCE. So all that information, sorry, so all that information will come together for you what I'm talking about right now, and I will actually show you a real example from National Examination Board of Dental Nurse examples with the real situation where I will pretend I'm being assessed. So please stay tuned, and I hope you really find it helpful, and good luck to you all.